How can crooked lips be fixed? The left side of my mouth is higher up than the right side. You can't tell when I smile, but when I make any other face, you can definitely tell, and it makes me very self-conscious. How can I fix this? Thanks for your help.
Thank you for your question. You submitted 2 photos with your question, and one with your mouth at rest, as well as one with you smiling. And you state in your question how can the asymmetry of one side of your mouth appearing to be higher compared to the other, can that be improved? Well, I can certainly share with you my approach to patients like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and lip enhancement is an extremely popular area of concern for patients who come to us in our practice, and it's in all age groups that people are very concerned about lip aesthetics. So essentially, when I look at your photo, what I notice is at rest, it's not so much that the one side of the face is higher than the other, but rather just the way the lip bows upward, relatively speaking, showing more of the front teeth compared to the right side versus the left. So, and when you smile, there's no perceivable difference. So essentially what I suspect is an issue that can be improved, yet probably not achieving perfect symmetry, is to try to place volume in the pink part of the lip. When we look at lip anatomy is actually very detailed. And there are different aspects of the lip anatomy that can be addressed. The areas such as the cupid's bow, the vermilion border, the lip roll. There's all kinds of, as doctors, we try to look analytically at the lip so that we try to address specifically placement so that you get a natural look. One of the biggest concerns people have about enhancing lips is to avoid, as almost everyone says, looking like a duck. And that unfortunately is the benefit of certain celebrities and well-known people having disproportionate appearance to the lips. Ideally, we're not talking necessarily, I should say specifically, we're not talking about changing a lot when it comes to the proportionality of the lip, but rather to fill a deficit. This is something that actually happens with facial aging, and I'm not saying that that's the case for you, but a relative absence of volume, whether it's genetic or whether it is from aging and changes with decades of aging, the goal is to try to place filler to reinflate or restore up to a point the area of concern. So I think that most likely placement of filler in that particular area will be optimal. Now, the fillers that I'm talking about fall mostly in the hyaluronic acid family, such as Restylane and Juvederm. And the technique that I employ is the use of blunt cannulas, where there's almost no likelihood or minimal likelihood of bruising and avoiding multiple pokes in the area that's being treated. Now, a lot of doctors like to do the injections directly into the lip with the needle, but I found that placement with a blunt cannula and a strategic entry point away from that part of the lip, I find I get very, very nice results, and the before and afters look very good, and the patients benefit from not having too much swelling. Lips do swell a little bit after any injectable filler, but the goal is to try to get close to the ideal goal that you want to achieve and minimize the amount of trauma and reactive swelling. But that's more about technique than it is about just the issue anatomically. So relatively speaking, again, looking from the perspective of your anatomy, essentially there's a relative volume deficit in that area relative to the other side. And of course, understanding that when you smile, everything looks natural and good, you don't want to overfill. So you want to just achieve improvement. So if your goal is improvement, I think that fillers is the way to go. So I hope that was helpful. I wish you the best of luck. Thank you for your question.